Welcome back, everyone, to your Healthline 3. I'm Nate Fluharty. We are talking today with Dr. Ricky Paul, an OB-GYN with Willis Knighton Health System, and some very big things that not only he's working on, but we want to help you throughout Healthline 3. So get those questions ready as we dive into some very important topics and how it translates to your health, or maybe the health of you and a family member. So, Doc, thank you so much for being here with us today. We really appreciate it.
Yeah, well, thanks, Nate. Glad to be here.
So let's dive right in, Doc. Of course, one of the things we're going to be talking about this morning are hormone replacement therapy, but there is so much that you do. First, let's talk about that and where you're located. We mentioned Willis Knighton Health System, but also what you do.
Yeah, so I'm over at Willis Knighton Pierremont. That's my main office, and I'm a generalist, OB-GYN. I've done that for over 20 years and mainly concentrate on overall women's health. Of course, deliver babies and take care of women during their pregnancy, but gynecology also, women who come in with bleeding problems or hormonal problems and things like that. That's a big part of the practice too. But not only that, I see myself as kind of a gatekeeper for overall health. Heart disease is the #1 killer of women, so it's very important that we're keyed in to make sure that women are getting their proper screening tests, their lab, their lipids, screen for diabetes, things like that. If they don't have a primary doctor, usually we'll screen for those and we'll get them in to see one of the primary doctors, because that is a very important thing. Immunizations is another important thing to make sure that they're caught up on, because frequently, especially younger women, they may only have you as a doctor. They may not have a primary doctor yet. So that's been a big focus of mine over the years.
Absolutely. And one thing too, I could only imagine how difficult it's been since the start of this pandemic, just for everyone in general to be able to get out of their house, to go see a doctor, and to keep up with those general practices. I'm sure it's been more than challenging over the past year.
Yeah, it really has. The pandemic did bring about difficulties. People early on, especially, didn't really want to get out, and they were afraid to come to the office or afraid to come to the hospital. There were times where we did limit, elective procedures and elective things, but again, that had a lot to do with the capacity of the hospital and the resources needed to take care of the people who did have COVID. But I think now, we're getting back to where the numbers in the hospitals are dropping for the COVID, and we're able to concentrate on what we initially had been, and thankful for that.
Absolutely. You mentioned numbers, and one very important number that you want to keep in mind over the course of this half hour is 318-219-4569. That's the toll-free number. If you have a question for the doctor about this topic or any topic related to women's health right now, OB-GYN specialist Dr. Ricky Paul will be answering those. So get that ready. And also, you can go to our website at ktbs.com and submit those questions for the doctor. And Doc, if we can, I'd like to ask you too. I saw you walk in. You were all masked up and all the COVID precautions. I'm sure that's something that has kind of changed over the recent months, and we're going to be touching on that in just a minute. Some of the COVID protocols you've done to keep everyone safe, especially all your patients. But I believe that we do have a caller on the line right now. Am I being told? Lynette is joining us right now. Lynette, thanks so much for calling in. Do you have a question for Dr. Paul?
Yes, I do. I am 65 years old, and I had to have my ovaries removed last year, and I did not go on any type of hormone replacement, but I've been able to tell a difference, like in mood swings, hot flashes, different things like that. Is that just a sign? Does everybody need hormone replacement, or what is your take on that?
Yeah, that's a very great question. And no, not everyone needs hormone replacement therapy. Hormone replacement therapy, you'll hear it's used for a lot of different things, but really the experts will tell you that it's only recommended for people who have severe symptoms of the menopause. Those being hot flashes, vaginal dryness, and things of that nature. If you have some of these symptoms and they're not really debilitating to you, it's really not recommended that you get on hormones because there are risks and everything. Now, you mentioned your age, 65, and that makes a difference too. There's a difference in beginning women on hormones or estrogen when they're younger, around the time of menopause, than women who are really older. And after the age of 60, 65, you have to be very careful with beginning hormone replacement therapy, because there's something called the timing hypothesis. And all these things that I'm talking about, we've learned from a lot of different studies over the years. And there's been some very good, big studies that have given us very valuable information. But heart disease is one thing. We know that hormone replacement therapy, we see an increase of heart-related events when you start these in some people. This seems to be more prevalent in women who are older when they start hormones. So, my recommendation for you, if you're not having the severe symptoms that are causing you debilitating, lifestyle or whatever, it's probably best if you tolerate them. I wouldn't start them at this time.
Great question there, Lynette. We certainly want to thank you for calling in. That number to call if you have some questions for Dr. Paul is 318-219-4569. Now, we are talking, of course, women's health and hormone replacement therapy. And Doc, one thing you just brought up too, a very important timeline right there as far as when women should look into this. Can you give us, I guess, the correlation between menopause and how this therapy can help and when it can help?
Yeah. So menopause, of course, surgical menopause can happen anytime. That's when your ovaries are removed through surgery, and then you're menopausal right away. But the natural course of menopause is your ovaries will stop functioning. Average age is about 51. Now, that you can have genetic things that your mother may have not gone through until she was 55, and so you may not. You may have a little later onset of menopause too. But usually the symptoms of the menopause are worse around the initial onset. And they usually peak about a year or so after the onset of menopause. These are when the treatments are the most effective. We treat with hormones, and there's different types of hormones. It depends on if you still have your uterus, or you've had a hysterectomy in the past and you still have your ovaries, or you don't. But that makes the difference. And there's different risk profiles with those different things, and we'll talk about that some too. Hormone replacement therapy is kind of, it's a combination kind of dual therapy. Estrogen is the main hormone we think about, and this is the one that, yes, it will help relieve these what we call vasomotor flushes. You feel a power surge, so to speak. You'll feel that warmth come over you, and you'll flush, and then you may have a little sweat. This can last anywhere from 1 to 5 minutes, and these seems to be the most debilitating type symptoms that are bothersome. So if you still have your uterus, you haven't had a hysterectomy, if you take estrogen, you have to take a progestin hormone or a progesterone. Because if you don't, that estrogen will stimulate the lining of your uterus, and it may increase your risk of developing a precancer state of the uterus or even uterine cancer. So we have to offset that risk with that progestin hormone. Now, if you don't have a uterus, you can take estrogen alone, and thus, because you don't have that risk. Now, the significance of that is back in 2002, there was a large study, and it's one of the most referenced studies that we have pertaining to hormone replacement therapy. It was called the Women's Health Initiative. And in this study, they had a group of women who were taking hormone replacement therapy, a group of women who were taking estrogen alone without the progestin, and a group of women who weren't taking any hormones. And what they saw was that on the combination hormones, the one with estrogen and progestin, that about after 5 years of use, we started to see a small increased risk of breast cancer. And that's where we get all this data from that you hear about, well, hormones cause breast cancer.
Yeah.
That's that. Now the significance of this is women who had estrogen alone, we didn't see that increased risk of breast cancer in them. So, you know, that's a real thing to understand. Usually when we do this hormone therapy with combination hormones, we try to keep it to the lowest effective dose for the shortest amount of time.
Sure. One thing too, when you think about that, when you talk about some of these symptoms, so to speak, I get mood changes, mood alterations, things like that probably come up. What is the correlation there when it comes to taking hormones, and what does that mean for a woman's mood?
Well, you know, that's a little more difficult question, because mood alterations can come about from lifestyle, anxieties and things in life.
Okay.
But, you know, if around the time of menopause a woman notices a big change in her mood, or more often her husband does, and he'll let you know about it, and which is kind of interesting. If they come to the visit with him, the woman might not tell you anything, but her husband sure will. But anyway,
things different on a whole other level there for the relationship.
So, you know, if they're having that and they're having some other symptoms too, and they want to try hormones, and they do, and then their mood gets better, then yeah, that can be you know, a thing that we see. But the difficult thing is, you know, anxiety and depression is so prevalent.
Yes.
Because of life stresses. So it's a little bit hard sometimes to delineate whether this is actually coming from those conditions or is it a hormonal change.
Now, during our newscast, you touched on the fact that this is basically something that every woman is going to go through. It's just something that happens in our lives, of course. But I think it was interesting to know too what you said, were saying with age, is that each woman, it can happen at different times. It's not like everything happens when they turn 50. So when do women, or when should women start reaching that point where their body is telling them they need some help, they need somebody like you in their lives to give them a hand? When do they start seeing those signs? You know,
there's some signs and symptoms, and we call it the perimenopause, and that probably anywhere from 2 to 10 years before women actually go through the menopause. And it's variable in different people, but some of the signs they may have are they may start to have a few hot flashes, things like that. But one of the big things we see a lot are menstrual irregularities. Your bleeding pattern is very sensitive to your hormones and the hormone cycle in a very specific way. And if that gets deviated just a little bit by a drop in certain hormones, then what we'll see sometimes is a woman, they may miss a period or two. And then after that, they may have a little prolonged or heavier bleeding. So this is one of the things that's very frequent that we see and bring women in especially in their 40s. And they'll come in because of this menstrual irregularity. And if you sit and listen to them, you pretty much know what's going on with them. And it's you know, it's probably due to getting close to the change.
Very interesting. I think this is such a fascinating topic, and how we're able to help with the hormones. So right now, the number to call, 318-219-4569. Dr. Ricky Paul from Willis Knighton in the Pierremont location. So right now, those questions being fielded, so get those calls in, and you can also go to ktbs.com, click on the little Healthline 3 there, and you can submit your questions, and we're going to be answering those throughout the time remaining. Now, Doc, let's get back to the treatment, to I guess the hormone. I think this is so interesting. The estrogen replacement. Is it just that for the women that are lacking estrogen levels? Is it a pill? Is it a shot? Or how are you able to boost that and make them feel better?
Well, that's a very good question, very important question. Yeah, so you can take pills, estrogen pills, but there's a different delivery system, which has some health benefits most likely. And this is giving the estrogen by either a gel or a patch or a vaginal ring, or you know, some people do injections still. It's not very common, but the significance of that is if you do that, if you don't swallow a pill, it bypasses the liver. When you swallow an estrogen, you get it's processed through the liver, and you get an increase of production of things like we call procoagulants, acute phase reactants, those things that we believed are involved in developing clots and things. But we now know, because of studies, that if we bypass that, what we call first pass effect through the liver, we don't get as much production as those. So we believe it's a much safer way of delivering estrogen with those transdermal and gels and things like that.
That is so fascinating. And another thing that I think is so neat is how fast technology has grown in your field specifically. And how, if you would give us an idea what women will experience when they walk through the doors of their office. I know keeping them comfortable and safe is the utmost of importance.
Absolutely. So, one of the big things I've always tried to impart in my practice, first off, is customer service. I mean, because if you don't have that, then it's not a very good experience no matter what you do. But then it's to sit and listen. You can sit and listen to most people and have a great idea of what's going on with them in a short time, and it'll help you tailor your further questions in your therapy and your evaluation of it.
So you're saying you don't have to, a woman walks into your office, has some questions, you don't immediately start going into, I'm going to grab my scalpel, let's get some tests done. There's a million things. You just sit there and listen to them. I love that.
Absolutely. That's extremely important in our field.
So what happens next? They lay out their plans, and when do you do a physical exam on the first visit, second visit, and what does your typical patient go through?
Well, usually when they come in, we'll sit and the nurse gets a lot of the history and everything from them and fills out their medical record. And then we go in and, we review that with them, and they're going to have what we call a chief complaint. So they'll tell us why they're there. And we'll kind of dwell into that and get to the bottom of why they're there. And then comes the physical exam, which is a very important thing. And in the physical exam, I've always kind of done more of a total exam. I like to feel their thyroid. Thyroid disease is extremely common, and I'll find 2 or 3 thyroid cancers every year just by feeling a woman's neck. But, of course, their breast exam, breast health is extremely important, especially as we age. The risk of breast cancer surely goes up, and it's a very common cancer. The pelvic exam that we do is very important. You've always heard of Pap smears, and a Pap smear is only a brushing of the cervix to detect abnormal cells. There's a virus that is very common, probably 80% of people carry this virus in their lifetime, called the human papillomavirus. And it can cause precancer changes or cancer of the cervix, so it's important to detect that. The newest screening recommendations are that we don't necessarily do a Pap smear every year. But the confusion comes in. Some women think, well, I don't have to go to the doctor every year, but that's not the case. You still need to go because we have to check for other things.
Right.
Ovarian problems, for instance, and enlargement. And we still have to do a pelvic exam to detect that because the Pap smear tells you nothing about that.
And preventative measures can be everything, as we've heard in the medical field. Great.
Yes.
Interesting. Thank you, Doc, for that explaining that. And I believe we have another caller on the line right now. Who do we have? Tanomia. Very pretty name. Tanomia, good morning. Thanks a lot for calling in. Do you have a question for Dr. Ricky Paul?
Hi.
Hi.
Hello.
Yes, I've had a history of fibroids.
Yes.
And as I done got older, my cycles be like Biden for like a week, and then it'd be like real heavy the next week.
Right. So, the thing with fibroids they're growths of uterine muscle, and they make balls. They come in different sizes. They can get very large, or you can have small ones. The symptoms they cause really depends on how big they are and where they're located. If you have fibroids, even small ones that are located on the inside of your uterus, close to the lining of where you bleed from, they can cause you to have the heavy periods like that. If they get very big, they can start crowding out your pelvis, and they can cause pelvic pressure and discomfort in there, increase urination because they press on your bladder and things like that. But the important thing that you talked to me about is the bleeding problems. You're having heavy bleeding, and it sounds like you're having some bleeding in between your cycles and a little prolonged. You know, aside from the fibroids, that needs to be evaluated to make sure you don't have pathology on the inside of your uterus where you bleed from, such as a polyp, which can cause that, or more importantly, something called hyperplasia, which can be a precancer state sometimes, and then as well as to rule out uterine cancer. So that, you know, the bleeding could be from the fibroids, but again, you want to have a complete evaluation to make sure that there's nothing else causing the bleeding. Also, spotting throughout the month, you know, you can have cervical abnormalities. Sometimes if you haven't gotten routine screening Pap Smears.
The week right before my cycle.
Yeah. Yeah, you know, and again, if you're having that, most likely, you know, if you're bleeding outside of the time of your period, it can be hormonal.
I only have one fallopian tube.
Yeah, but it also can be from the fibroids too. But again, you know, a complete evaluation would be necessary to determine what's causing that, and that'll help the treatment of it.
So, Nomia, thank you very much for your call. We do appreciate that. So we still have about 8 minutes to go here with the doc.
Thank you.
You're welcome.
And free of charge. That's one thing we love about Healthline 3 too. So we do have some ladies watching, maybe a guy out there with a special lady in his life that has some questions for Dr. Ricky Paul. We are here to answer them for the next 8 minutes or so. He is a professional OB-GYN. So we are also talking hormone replacement. Now, we just heard there from Nomia, and I think we have another caller on the line. And we have Betty on the line right now. Betty, thanks a lot for calling in. What's your question for Dr. Paul?
My name is Betty, and my question is that I had a hysterectomy years ago, and I have nodules on my thyroid, and all my readings are normal according to the endocrinologist, but my hair, I don't have any hair anymore, and I'm wondering on my body, and I'm wondering if this has anything to do with the hormones because of the hysterectomy.
Well, you know, it's funny you say that. Yes, hair growth has a lot to do with hormones. And as you go through the menopause, or if you've had your ovaries taken out and you're menopausal, you have a shift in the balance of certain hormones. Women make a small amount of male hormones. The action of male hormones, you know, they will increase hair growth in places that women usually don't have hair growth. They will increase the incidence of what we call a male pattern baldness. You'll get a thinning in the top of the hair, sometimes receding hairline. When you have adequate amount of estrogen, the estrogen will compete with the male hormones for receptors, so the male hormones don't have as much action. But once we go through the menopause and the estrogen levels drop, well, sometimes these male hormones will predominate, and you'll start to get these symptoms. Changes in hormones also can cause changes in cycles of hair growth. There's a thing called Telogen Effluvium. We see it all the time. See it a lot after pregnancy, with changes of hormones, with stress. It's a phase of hair growth that we see a lot of hair coming out. You'll see it in your showers and your sinks. Usually there's new hair growth behind it, but it's extremely common. But yeah, hormones can have a lot to do with hair growth.
All right, Betty, thank you so much.
Should I go have a checkup?
Oh, Doc, she's asked, should she go get a checkup? Should Betty get checked out by the doctor?
No, absolutely. Yes, especially if you have thyroid nodules, those need to be followed regularly, and I think you said your endocrinologist was following those, and that's great. But yeah, it's important to get an overall health checkup, you know, with your gynecologist. Just because you've had, you know, a hysterectomy, you still need to go, because there are other things as far as you know, breast health and you know, vaginal health too, that you know, they can help you with, as well as these look into the hair loss kind of things.
Okay, thank you very much.
You're welcome.
Well, thank you, Betty. We really appreciate your call, and we still have some time if you have any questions for Dr. Paul. That number is 318-219-4569. You can also go to our website on the Healthline 3 section and submit those questions. And we got a lot of callers today. Very nice to hear some folks calling in. Free of charge right now, too, so get those questions ready to rock and roll for Dr. Ricky Paul. We already have a caller lined up. Who was that? Who are we speaking with next? Felicia's joining us live on the line. Felicia, good morning. What is your question for Dr. Paul?
Good morning.
Morning.
Yes, I have two questions. I have one about how long do you stay on your menopause? How long do you be on your menopause? And the second question is, is it important for me to get these large fibroids out of?
Okay, so the first question, how long do you stay in menopause? Well, menopause means the cessation of ovarian function. You're menopausal forever after that. The symptoms of menopause, I think, are what most people are curious about, how long they last. Not everybody has symptoms, not everybody has severe symptoms, but usually on average they'll last about a year. But they can last from anywhere from 2 to 10 years. So it all depends on the person. But your other question, large fibroids. Again, we talked about earlier with one of the questions, the problems that they can cause, pain, pressure, bleeding abnormalities. If they've been stable and you're not having any of those symptoms, you don't necessarily have to do anything with them. It's important to get regular checkups with them, of course, but unless they cause you a problem, again, you don't necessarily have to get anything done with them. Fibroids don't turn into cancer, and that's sometimes a misconception. Now, there are a rare type of cancer that can mimic fibroids, and they grow kind of like fibroids, but it's rare. Women who have a history of fibroids and they've been there for years, they don't all of a sudden turn into cancer. That just doesn't happen. So it all depends on your symptomatology. If you're having a lot of pressure, abdominal heaviness, things like that, then yeah, you may want to seek care and see about getting those, fibroids out of there if you'd like.
All right, Felicia, thank you so much for your call. We do appreciate it. We still have just about 2.5 minutes left. So if you do have a call, give us a call right now. We got Kate on the line now. Kate, what is your question for Dr. Paul?
Kate on the line now. Kate, what's your question for Dr. Paul? Kate on the line now. Kate, what's your question for Dr. Paul?
Kate, I think. Good morning. Do we have you, Kate? Okay. While we line up Kate, let's talk about this, Dr. Paul. We're taking some great questions from viewers, and we're going to be wrapping things up here in just a little bit, but I don't want to close on a note without a little bit of hope. For the women watching right now, for those that don't have a doctor, are you taking patients right now, and what are some things that they should be doing right now to get in there to see you?
Absolutely. Yeah, we're taking patients. My office, I have 3 other partners now, and we have 2 coming in this summer, and we have plenty of room. I mean, if you're having a problem, we can probably see you same day. If you just want to come in at your convenience for a checkup, we can schedule that at your convenience. So yeah, we're very amenable right over there at Willis Knighton Pierremont.
Okay. Well, we have time for one more call. That's great to hear, Doc. Thanks for keeping us updated on that. We have Judy on the line. Judy, what is your question for Dr. Paul?
Yes.
Judy, you can go ahead.
Okay. Hello. My question is, I'm 74 years old, and I feel as if that...
I'm sorry, Judy. I think we may have lost your call there. You're breaking up just a little bit, Judy, and unfortunately, too, we are running out of time. But Judy, if you would, please go to our website, ktbs.com, or you can stay tuned. Doc, for Judy right now, I don't want to leave her out there, but can she call your office? And if so, do you want to put your number out there for her or other potential patients?
Absolutely. Yeah, our office number is 318-212-3890, and we're there every day. So yeah, if y'all just call and we'll take care of you. Mm-hmm.
Great, and that is the Willis Knighton Pierremont location.
Exactly. Mm-hmm.
All right, so we can't thank you enough, Dr. Paul, for coming and talking about this very important issue for the women in our lives. I know several things that you touched on today that I've had family members deal with. So we all have those special women too. So thank you so much for clearing up a lot of these questions for many of our female viewers too. If you have anything that Dr. Paul can help you out with, please reach out to Willis Knighton Pierremont. You want to give the number one more time? And maybe your website too?
Yeah, 318-212-3890, and our website is Willis Knighton OB-GYN Pierremont Specialists. And it's also on Facebook.
All right, great. Dr. Paul, we can't thank you enough for joining our Healthline 3 family, and we can't wait to hear more of you in the future about this very important topic.
All right. Thanks, Nate, for having me.
No problem. That's going to do it for our Healthline 3. Everyone have a very happy and healthy day.